aspiration training, and I am making this video to make it easier for yourself when it comes to the time where you need to do your oral hygiene simulation. Okay, so this criteria meets criteria within Unit 311. So for this simulation, we have specific criteria that we must meet. So you could deliver an outstanding oral hygiene simulation for 20 minutes long, but if you don't cover all of the criteria, then you will need to do a professional discussion with your coach to gain the outstanding criteria. I'm going to talk you through exactly what you need to do so you can be well prepared and make sure that your video, your recording, meets every single bit of criteria. Okay, so first of all, your coach will send you an oral hygiene plan for you to complete, and they will also send you a document with 3 different patients on. Okay, I'm going to share my screen so I can show you what sheets you will receive. Just bear with me a second. Okay, so first of all, this is the sheet that has got 3 different patients on. The first patient is a young child who has braces and they need a fill-in. So obviously you're going to have to motivate this patient. They're 13.5 years old, teenage boy who may probably attend the appointment with their parent as well. So make sure you include that. It does say mandatory questions on here. They're not actually mandatory. You can think of your own questions if you want, as long as they're good questions that is relevant to the patient that you've chosen. So the first one, a child with braces. Your second patient that you can choose is an elderly patient that's got a fungal infection who has a denture. And then the third patient that you can choose is a pregnant lady with gingivitis. It'll tell you exactly a little bit of background about each patient. Only choose one. You don't have to do it for all 3. Choose one patient that you think, yeah, I want to do that one. Once you've chosen your patient, you will then complete this plan. Who is your target audience? Talk about your patient. Which one have you chosen? Information that you're going to deliver relevant and beneficial to that patient. So for example, if you've chosen the pregnant lady, you might want to recommend interdental cleaning, mouthwash. If you've chosen the elderly patient, you would want to deliver advice to a carer as well, probably. If you've chosen the child, you need to be more motivating. Use apps and things like that that's going to be relevant to that patient. What are you going to use? So models, toothbrushes, floss, TPs. What are you going to use within that simulation? And then what questions are you going to ask your patient to ask you? So you need to record this with your colleague. And it needs to be recorded within the workplace. So yourself and your colleague need to be on camera, and you need to be talking to them as if they're the patient and it's a real life situation. They can ask whatever questions they want, you know, if it flows better and it's more natural that way. Or you can tell them prior to the simulation, these are the questions I want you to ask. They must ask at least 2. More is better, but at least 2 questions. Make sure they're engaging, you're letting them speak, and you are answering their questions with valuable information. Okay, once you've done that, the criteria that you have to cover is as follows. So you've already done your plan. Once you've done your plan, you can go ahead and record your simulation. Make sure the video is clear, and make sure you're both on the camera, and make sure that your models and toothbrushes and things like that are seen on the camera. Now, we also need consent for this recording to take place from yourself, 1, 2, your colleague, 2 separate bits of consent. So you can either do that on the recording, or we can send you the paper consent form. We need 1 from yourself and we need 1 from your colleague. Then, before you even start with your simulation, You need to, first of all, introduce yourself, check the identity of the patient, and then tell them the purpose of the visit. So here's an example. Hi, I'm Sophie. I'm a dental nurse. The dentist has asked me to give you some advice because you need a fill-in and you need braces fitting. Before we go any further, please can I just check your name and date of birth? If you don't say that in your recording, you are not going to meet that criteria. So you must include that at the beginning. The patient, the colleague, they can either say their own name and date of birth because we're not assessing them, or they can make one up that's relevant to the patient that you've chosen, but it doesn't matter. Then you're going to show to the camera what models, toothbrushes, leaflets, media tools, and things that you plan to use. So just say within this simulation, I'm going to use this, this, and this. Then you're going to deliver your advice. So face your patient, give them your advice, how to brush, talk about diet, incidental cleaning, as much information as you can. It is very important that you include a leaflet. You can either get one from your practice, print one off, or use a poster or anything like that. Just make sure you include a leaflet because again, that is a piece of criteria that we need to meet. Another thing that you need to use is a media tool. Everybody forgets to do this or they don't show it on the camera. You must show it on your recording. If you choose a website, you've got to show which website. So if you're recording it on your phone, you're going to need another device, computer, another phone, an iPad to show that media tool. That can be a website, it can be an app. What else could it be? It could be a video on YouTube. Anything that you think is going to be suitable for that patient. Obviously, if you've got the elderly patient, you probably wouldn't recommend an app. You'd maybe give them a website or a video to watch that you can send directly to their email. So it's easy for them to watch. They just click it and watch it. And obviously discuss it with the carer. You must use these. So you must use a leaflet, you must use a media tool. And for your media tool, show it to the camera. If you choose a video, don't play the full video, just play the first few seconds so we can see which one you've recommended. Address the problems that the patient is facing. Tell them what will happen if they don't follow your advice, the consequences of not following your advice. Let them ask questions. Encourage them to ask questions and then give them constructive feedback and some advice going forwards. Motivate and interact with your patient. These are all different bits of criteria. If you miss any of these out of your simulation, you will have to either do the simulation again or we can gain it as a professional discussion. So for example, if you forgot the leaflet, we'll then do another recording, talk about what leaflet you would recommend and why. Once you've recorded your video, sometimes it's too big to upload to Smart Assessor. Don't panic, that's absolutely fine. Send it to your coach on WhatsApp if they're happy for you to do that. That will compress the file and then your coach, personally, I'm happy to upload it for my learners. So see if your coach is happy to do that. If not, you can upload it in 2 videos and we can group it together on Smart Assessor. Make sure when you send it to your coach that it's not cut the video short, because I've had that before. Make sure it's the full video and watch it before you send it as well to make sure you're happy with it. I think that's everything. So if you've got any other questions, please reach out to me. My name is Sophie Godson and good luck.